So good evening and welcome to this International Center for Moral Injury, or ICMI webinar, which will feature a presentation by Shannon Allen, a research fellow in psychology from Northumbria University. My name is Brian Powers. I'm the executive director of the International Center for Moral Injury. As tonight's webinar resonates deeply and directly with the aims, vision, and purpose of the ICMI, I should just note that the ICMI is committed to producing and receiving new scholarship on moral injury, facilitating new research by building networks of academic scholars, military members, chaplains, clergy, and others with knowledge of and experience with moral injury. The ICMI seeks to create and develop resources for counselors, caregivers, churches, and faith organizations caring for morally injured individuals. And each of these things serves the center's ultimate goal of increasing an understanding of the causes of and impacts of moral injury and facilitating increased care for those experiencing it. Lastly, let me just note as well, as with all of our webinars on moral injury, certain aspects of the conversation may evoke quite intense reactions within us. So please exercise self-care and stepping away if you need to, and know that there's help available if you feel overwhelmed. Jane is posting the link to lifeline-international.com, and I would certainly invite you to utilize the link to seek help if you need. So without further ado, let me introduce our speaker for the evening. Shannon Allen is a research fellow in psychology at Northumbria University. She has an academic background in psychology and forensic psychology, and recently submitted her PhD in criminological research at Northumbria University on the project she's talking with us about tonight. Shannon has 5 years of moral injury research experience to date and has co-authored various academic publications on moral injury, exploring the impact of PMIEs across various UK veteran populations, including those with co-occurring exposure to traumatic events, SP veterans, and LGBT+ veterans affected by the historic gay ban within the military. She was the lead author on the article that was just published last week. I should note that Shannon has had quite an eventful week. She submitted her thesis, had an article published, and began a fellowship. And we're delighted she's taken the time to present with us tonight in that busy moment. So Shannon, it's my pleasure to turn things over to you.
As Brian mentioned, today I will be discussing my PhD research, which was investigating potentially morally injurious event exposure among service police and non-service police veterans. So just to give a brief bit of background to the research, just to start, the project was meant to fill a gap in the current research literature related to a lack of conceptual clarity and consensus, mainly around the definition of moral injury, the assessment and intervention for moral injury as well. And this was mainly in regards to highlighted criticisms within the MI literature related to the fact that people often noted the subjective experience of a value violation during potentially morally injurious events, but they didn't actually specify the specific values that were being violated by these events or wider individual and contextual factors involved in the development and recovery of moral injury. And that was where I hope to try and fill the gap with my PhD research, as well as building on wider limitations within the empirical research literature related to not just a lack of research on moral injury within the UK context, UK military context, in comparison to other populations such as the USA, as well as the lack of research on specific military cohorts that might be particularly at risk of PMIE exposure. And that leads me on to my pilot study, which is referenced below, which was investigating PMIE exposure in service police veterans for the first time. And so for those of you who don't know, service police veterans, they are both military personnel and fully trained and warranted police officers, and they're responsible for policing all crime within the military. And I hypothesized that these individuals might be particularly at risk of PMIE exposure because of the nature of their role, overlapping both police and military duties, which also might add an additional level of complexity to their moral value system. So in this research, I found that service police veterans were in fact exposed to potentially morally injurious events. And I also supported wider MI findings from the non-service police literature. However, there were several underexplored findings and also those potentially unique to the service police population that required further investigation using a larger sample and a more robust research design. So that leads me on to my PhD research then, which was the aim was to investigate and compare the experience and impact of PME exposure between service police and non-service police veterans. And the types of research questions that I investigated involved uncovering the types of PMEs that they were exposed to, as well as I mentioned, the specific moral values actually being violated during those events. As well as the longer term impact of that PME exposure, different coping strategies used to try and manage those different events, and moral dissonance, which is the experience of that conflict of values being transgressed. And then also wider risk and protective factors involved in that experience and impact of PME exposure. So, as I mentioned, I was taking a mixed methods approach, which is a more robust research methods design using both interviews and survey. So the first phase involved interviews with 52 veterans, 18 service police, 34 non-service police. And these were really quite similar demographically in terms of about 75% male, a good spread across the different service branches, ranks, different military roles. And the only real difference was the fact that SP veterans were about 10 years older on average. And then of those 52 veterans, 35 then went on to go and do the survey. And so today I will really be talking about the combined findings from both of those phases, and then highlighting any instances where they might differ as well. So the first main finding involved the types of moral values endorsed by the different veteran groups. And this was shared across the different veteran groups. But there were slight differences depending on how they were categorized between the survey and the interviews. So in the interviews, I just asked veterans their personal moral values, how they might be aligned or misaligned with those instilled in them during the military. And they really went into the process of that value installation as soon as they joined the military and in that recruitment process, where they were instilled in a repetitive sort of way with the values and standards that were based around 4 categories of values relating to loyalty, integrity, discipline, and human empathy. And as I mentioned, these were shared between the veteran groups, but there was a slight indication that service police veterans potentially had an increased level of stringency that they had to uphold those values due to the nature of their role policing law and order in the military and acting with impartiality to uphold the law, and also an increased potential use of empathy during investigations to ensure cooperation of witnesses and suspects. In terms of the survey data, this was more about rating the importance of 10 domains of values as a guiding principle in their life, and both groups highlighted benevolence as the highest rated value, which links to that empathy value being picked up in the interviews. However, there were also some slight non-significant differences between the veteran groups in that SP veterans highlighted higher endorsement of values relating to security, which again supports that potentially increased level of stringent value adherence, as well as NSP veterans suggesting that power and conformity were opposed to their values and more highly rating values related to self-direction, which actually conflicts with those 4 categories based particularly on the importance of discipline. So just highlighting some mixed results there as well. And in terms of the types of PMEs that they were exposed to during their military service, this was again similar between the 2 veteran groups in terms of cumulative exposure throughout their military career to self or other transgressions of the moral values I mentioned in the previous slide. But again, there were categorization differences based on how they were assessed in the different phases. So the first interview phase involved identifying mainly the value being violated by the specific event and linking that to the value violation of one or more of those value categories. So this mainly involved violations of relating to senior rank and leadership in terms of toxic leadership, misuse of resources, abuse of authority, inconsistent application of morality in terms of discipline and administrative processes, as well as receiving orders that they found quite dissonant and difficult to deal with, and also a wider lack of responsibility by the military authority to support service attributed harm for military personnel and veterans. The second aspect involved violations around the legitimacy and morality of certain operations mandates and duties that they had to uphold, and this really related to sort of questioning the motives behind those different mandates over time, as well as questioning whether it was worth it in terms of the suffering of different civilian populations, and questioning whether they or others actually had a sort of absence of humanity over time and this cumulative exposure to these different types of events, as well as confusion about whether overall they did more harm than good. And then the last aspect involved events perpetrated by themselves or other military colleagues that violated aspects of social trust, camaraderie, and loyalty in terms of harmful or questionable behaviour towards each other, including bullying, harassment, abuse, and also in veteran life, this also included prioritisation of family commitments and questioning whether civilians had lower moral standards than military personnel. However, in terms of the survey data, this was really categorised based on their agentic role in the event in terms of whether perpetrated by themselves or other people or involved combat-related elements. And this was a sort of assessment that reflected assessment tools within the wider MI literature, which have their own criticisms and limitations. However, again, there was similarity in that type of exposure, but again, non-significant differences in that, in general, SP veterans had higher levels of potentially combat-related exposure and also those perpetrated by others, whereas NSP veterans had higher self violations. In terms of impact of these types of events, again, this was really similar between the two veteran groups in terms of complex presentations of both positive and negative outcomes. And the negative outcomes really related to impaired functioning across different domains of well-being, and that included psychological dysfunction in terms of symptoms, but also diagnoses of PTSD, depression, anxiety, self-injurious thoughts and emotions, difficulties with civilian reintegration, as well as substance misuse. And also emotional related to self or other directed emotions, insidious moral emotions, including guilt, shame, anger, disgust. Wider moral impairment included whether they had a higher level of moral awareness or critical reflection ability to be able to link all these different types of moral injury related outcomes to their potentially injurious event exposure, and also whether they self-identified as having a moral injury, which was actually quite rare in the sample and only happened with, I think, 2 or so non-SP veterans. In terms of social dysfunction, this more involved difficulties maintaining and building social relationships, social withdrawal, lack of perceived social support, and then also occupational functioning regarding whether their symptoms interfered with their ability to do their job, as well as having to leave the military early and experiencing similar dysfunction, difficulties gaining and maintaining employment in civilian life, and also associated financial and housing instability. And then the last aspect really involved poor physical health in terms of sleep problems, weight changes, chronic pain, fatigue, and other physical health problems as well. And then the second aspect of those negative outcomes involved a negative change in previously held beliefs about themselves, the military, and civilian society. So this really involved low, in terms of the self, this involved low self-worth, low self-esteem, a changed view of themselves as potentially not a good person or not with high moral standards, or who potentially couldn't be forgiven for the things that they had done, as well as a wider cynicism, disappointment, and lost faith and trust in military institutions and civilian society in general. However, the interviews really demonstrated a more in-depth level of insight into these negative outcomes in terms of interrelationships between the different types of impairments and disillusionments, in terms of if you had high comorbid psychological symptoms, you're also more likely to have poorer social dysfunction and poor physical health, for example. And then also disillusionment in terms of, for example, self-disillusioned beliefs projecting onto the wider military and civil society beliefs and vice versa. And also the interviews picked up a broader range of these different types of outcomes as well. And then in terms of positive outcomes, it's mainly related to post-traumatic growth, which has experienced positive psychological change after potentially more injurious or traumatic events. And this was related to a lack of regret, increased self or life satisfaction, increased meaning, closeness with others, increased personal resilience, strength, and moral growth, and that they had the ability to then deal with these types of events more clearly in the future, and also had a strong idea of their moral boundaries, as well as being able to achieve self or other forgiveness for different experiences. And then the second aspect involved a differential ability across the different veteran groups, about their ability to achieve holistic acceptance of their experiences. And this was either full or partial in terms of some people were able to really take both the good and the bad events that had happened to them and say, this has made me the person who I am today, and then experience no real regret for anything that had happened. Whereas other people demonstrated more partial acceptance in terms of they'd resolved it as much as they thought they can, and it didn't affect their daily life, but they occasionally thought about these sorts of things, or symptoms emerged now and again, but it was mainly managed and required continued management over time. But again, despite this complexity between the veteran groups, there were, again, those non-significant differences in terms of SP veterans experiencing fewer negative and more positive MI-related outcomes in general, which was potentially related to the different types of coping strategies that they used to try and deal with these events, which I'll talk about in the next slide. So in terms of different strategies then, so this was again shared between the two veteran groups in terms of their initial responses to potentially morally injurious events, mainly relating to moral engagement and moral disengagement. And moral engagement related to different strategies, including acting with moral courage in the first instance to prevent violation of different values, going into meaning making and making sense of different sorts of events and really engaging with the event, trying to untangle their own responsibility and involvement in different events and making sense of them, focusing on the good that they have achieved during their service career, engaging in positive action such as engaging in charity work or amends making with people who had been harmed by certain events, to really reach that process of full or partial acceptance. And then in terms of moral disengagement, this more related to compartmentalization of associated thoughts and emotions to stop them negatively affecting their well-being while they were in those situations. But there was a potential suggestion that this might develop into more negative manifestations over time without those more adaptive strategies. And other MD strategies involve suppressing emotions, including the use of substances for numbing, the displacement of responsibility to others, for example, those who gave them the orders or the wider military, including diffusing responsibility also with people who were involved, as well as prioritizing different values and establishing firm moral boundaries in terms of I am able to compromise certain values to uphold ones that are more important to me. And also being able to move on from things that you couldn't change rather than dwelling on them. And then these strategies were also supplemented often by the use of both informal and formal support. And so informal support involved mainly social support from both military social support networks and civilian ones in terms of friends, family, military peers, and also veteran community once they re-entered civilian life. And this also included identifying a key individual, such as a military mentor or a spouse or partner who they could really rely on, be vulnerable with, share their experiences and get good advice from. But there were also identified barriers to engaging and benefiting from this type of support, including the sort of culture within the military of not discussing or seeking help for mental health and moral issues. As well as the sort of fast-paced environment of the military. So you don't have time to sit around talking about your feelings, as several veterans said to me. And also engaging in sort of unhelpful venting processes rather than actually solution-focused discussions, as well as fearing that you'll be a burden to other people by sharing your experiences, particularly those from the civilian social network who might not necessarily understand the experiences or whom they feared receiving negative judgment from as well. And then the second aspect of that informal support also involved informal self-management strategies that they use to try and regulate emotions and thoughts, including engaging in sort of creative or physical exercise, hobbies, activities, and also mindfulness-related techniques such as thought challenging as well. And then the second aspect of the types of support that they were using was more formal support. So they identified the fact that there were effective interventions in terms of medication and psychological interventions that they found useful in both a military and civilian contexts, including the value of receiving a diagnosis of a specific for example, mental health disorder, or even hearing about the concept of moral injury and self-identifying with it as an almost validation of the types of experience that they'd gone through. However, more broadly, there were a lot of criticisms about this support in both military and civilian contexts, which I'll go into the sort of recommendations that they made about this later. But this mainly involved sort of lack of knowledge, lack of proactive monitoring of well-being, negative service provider experiences, and just general lack of availability, accessibility, engagement, and efficacy of that support. And again, going into the sort of non-significant differences between the veteran groups, SP veterans were highlighted as potentially using more moral disengagement strategies, whereas NSP veterans more were using that moral engagement and use of external support, which potentially, linking back to the previous slide, has some quite interesting consequences, because SP veterans were just demonstrating non-significantly, at least, those fewer negative outcomes, which could potentially be related to that increased use of moral disengagement, that they were keeping those negative manifestations at bay, at least for the time being. However, also the increased use of those more adaptive support strategies by the NSP veterans, despite the fact that they were showing fewer positive outcomes, also potentially demonstrates how ineffective, or the limitations of that support that they were using as well. So the last aspect really involved the different risk and protective factors that were involved in the experience and impact of potentially morally injurious events, which were both shared by both veteran groups, but also independent, and acted often as both facilitating factors and also barriers to experiencing more PME exposure, the types of coping that they were using, as well as the development of both negative and positive outcomes. And this really related to, for example, the first aspect is pre-military motives and expectations. So whether they had idealistic or practical reasons for joining the military could potentially be both a facilitating factor driving them through difficult events to achieve a specific goal, or potentially a risk factor if they weren't able to fulfill those specific expectations. And then the second aspect involved whether having a strong sense of morality acting as both a risk and protective factor, as well as wider aspects of the military environment related to a sort of culture of promotion of rank and achieving a different higher career progression over potentially acting with moral courage that did prevent a few people from experiencing more adaptive coping, as well as also factors relating to that influence their adaptability to military life, and also susceptibility to almost adopt the mindset of obeying values and standards without really thinking critical reflection on them, including both age, rank, socioeconomic status in terms of whether they were from areas of high unemployment, low opportunity, as well as whether they were involved in both combat-related roles or more technical-based roles. So they acted as both risk and protective factors in certain aspects. The next aspect involved the types of PME exposure. So high PME exposure was often identified as a risk factor for worse outcomes, and this involved exposure to more types of PMEs, but also PMEs involving multiple value violations, as well as specific event characteristics. So overseas operations were highlighted as particularly increasing the risk of negative outcomes, including having vulnerable civilian victims, having a lack of agency to act because of low experience or rank in certain situations, and just aspects of the events themselves that were also increasing risk of both maladaptive coping and also those negative outcomes. In terms of choice of coping strategy and support, as I mentioned previously, moral disengagement in the interviews at least was identified as a short-term protective factor, preventing that development of those negative outcomes. Also potentially acted as a risk factor over time and became less effective without that use of adaptive support. However, in the interviews, both MD and ME coping was identified as both a risk and a protective factor. So just highlighting the level of mixed findings that I was identifying as well. And then the last aspect really was only picked up in the interviews, and that was related to the complexity of the MI-related presentations in terms of those interrelationships between the different types of impairment in terms of aspect of well-being, as well as the disillusionment, so high comorbid psychological symptoms, increasing risk of social dysfunction, for example, as well as in particular the disillusionment. For example, military disillusionment often caused further self-disillusionment for their involvement and complicity in certain military events, as well as wider disillusionment about civilian politics and institutions who enabled and authorized certain military endeavors. So just to summarize that section then, in terms of the service police, non-service police comparison, there were broadly similar experiences between service police and non-service police veterans. However, there were those slight non-significant veteran group differences in terms of the different value endorsements, the increased MD coping by service police veterans, and experience of more negative and fewer positive outcomes for the non-service police, and as well as those shared and independent risk factors. However, because these were actually non-significant, in general, SP veterans were not more at risk of PMIE exposure and negative MI-related outcomes than non-service police veterans. And actually, it was hypothesized that really there were other factors that were potentially more influential than service police or non-service police veteran status. And this included individual factors in terms of their level of moral awareness or ability to have moral courage, as well as sort of the type and frequency of PME exposure in terms of whether they knew the outcome of that event, whether they were able to resolve that, and then the subsequent choice of coping strategy and support. So identifying those other factors that could be potentially influential other than service police or non-service police veteran status. However, there were also some general conceptual implications of the research beyond the different comparison of the veteran groups that applied to across the whole of the veteran population and future of MI research. And this included the need to value of actually adopting a value-centric approach to moral injury in terms of unpicking that installation and violation of the specific moral values underlying PME exposure, and also the interactions between those pre-military motives and expectations, and just understanding more of the context of PME exposure to then help understand how that influences their subsequent choice of coping and the complexity of those different manifestations of moral dissonance as well. And also that complexity that I mentioned in terms of the manifestation and management of moral injury also having implications for the future need to adopt a more holistic approach to moral injury development and recovery as well, potentially using a balanced, the advocation for a balanced use of both MD and ME coping supplemented by external support. So demonstrating how these conceptual implications also have wider practical implications for MI prevention and intervention. So these practical recommendations include the need to increase preparedness for encountering PMEs, as well as that adaptive management of moral dissonance. However, to do that, in terms of adaptive management, you need to also make sure that the support structures are there and you improve access, engagement, and efficacy of those different types of support structures to support that process. So going into the different recommendations then, the first aspect was about MI prevention. And this was in terms of veterans highlighted how they thought the current training process wasn't really sufficient or flexible enough and needed to be updated to include increased understanding of the self and also their own morality. So what are my strengths and weaknesses? What are my personal moral values? How do these align or misalign with the values and standards instilled by the military? And getting recruits to learn more how to discover, verbalize, and critically reflect on their values before they then enter those extreme environments where these values are then going to be challenged. And then the second aspect really involved not just repetitively reinforcing these values, being like, you have to follow these no matter what, they'll apply to all situations, but really going into potential moral dilemmas and scenarios that they might encounter and coming up with ways to try and resolve those situations and have more of a realistic expectation of how those values might not always apply to different situations, how some of them might be open to interpretation, and really just increasing their preparation for encountering those different types of events. And the next aspect of that increased training and education involved increasing knowledge of the socio-political context of war. and also the sort of wider socio-political structures, just to increase that contextual knowledge, to try and just understand more of the context of the different operations and duties and things that they were going into, as well as increasing knowledge of both the signs and symptoms and manifestations of moral injury, and also adaptive strategies to manage that moral dissonance as well. However, the last aspect also suggested that this training has to be accompanied by wider cultural change within the military to cultivate a more responsible moral community collectively. And that involved increasing ethical leadership within the military so that senior leaders understand how rules and regulations will apply on the ground, how to support senior leaders to actually resolve moral conflicts and make good, sound moral decisions, and also more consistently embody and uphold values and without that more inconsistency, and having increased supervision and accountability within the chain of command and the different disciplinary and administrative processes, just to increase that level of accountability to adhere to moral values, as well as encourage a wider responsibility within the military to challenge morally dissonant situations, avoid crossing moral boundaries, and just establishing that collective responsibility for morality within the military as well. And then the second aspect involved more recommendations for MI intervention in terms of dismantling cultural reinforcement of MD coping related to, for example, emotional suppression and substance misuse within the military. So acknowledging the limitations of those MD coping strategies, and normalizing the experience of moral dissonance and destigmatizing the use of more adaptive ways of dealing with that dissonance and the use of those formal and informal support structures. But then, as I mentioned previously, to do that, you also need to make sure that those support structures are actually in place and effective and available and accessible, which leads me to the next element, which involves how you need specific recommendations to improve the military specific support in terms of increasing availability of those effective pharmacological psychological interventions, increased proactive monitoring and assessment of well-being, including timely decompression and debriefing after difficult events that isn't just a tick boxy sort of exercise, but is actually relevant and individualized to the person, and also includes signposting to early interventions to that formal support if they need, as well as bolstering that formal support by the promotion of more structured peer support processes that focuses on solution-based discussions more than that unhelpful venting, as I mentioned before. The next aspect really involved increasing the perceived and actual independence and confidentiality of military support. So individuals feel like they can report morally ambiguous behaviour or seek help for certain issues without that getting back to the chain of command or affecting their career progression going forward. And the last aspect really involved just generalised expansion and individualisation of that military transition support to move away from more generic employment-based workshops that are currently available and go more into practical preparation for military life in terms of how do I register for a GP, how do I manage my finances, how do I pay my bills, as well as, again, that wider cultural awareness training in terms of potentially becoming aware of any biased perceptions you may have developed of civilians during your military service, and destigmatizing and normalizing that, as well as creating more formalized pathways from military-specific support to those more veteran-specific supports in civilian contexts as well. And so going into that in a bit more detail then, in terms of cross contexts recommendations, these included not just increased availability of that support, but increased awareness of all the different types of support that are available across military and civilian contexts, as well as increasing service provider and service knowledge of the complexity of military personnel and veterans' experiences, and also then their complex needs, specifically relating to the manifestation of moral dissonance or just in general, as well as the need to then develop more holistic interventions to address those complex needs. So not having, for example, a psychological intervention that you can't join because you have associated substance misuse, when we know it's a comorbidity that is quite common. So just ensuring that care is more holistic and coordinated as well. And then the last aspect included, again, that more cultural aspect in terms of increasing open dialogue between civilian society and the military community and the realities of service life, and increasing and facilitating mutual understanding and accountability to support veterans holistically. And that also includes increased accountability by the military to take some of the burden off those civilian services providing support for veterans, and with their own limited resources, location dependent access, for example, and lack of really specific military knowledge. So taking the burden off some of those services and taking more accountability to support veterans, in particular for service attributed harms as well. And so I'll go into the recommendations after this, but just general conclusions then. So this research really represented the first time that the experience and impact of PME exposure was investigated and compared between UK service police veterans. It demonstrated broad similarity across service police veteran and non-service police veteran experiences, as well as those negligible, non-significant differences between the veteran groups. However, the main sort of takeaway from the project is actually the complexity of their exposure, manifestation, and management of moral dissonance, which requires that value-centric and holistic approach in future research, which could be aided also by those more practical implications to improve MI prevention and intervention in terms of training and also the support structures. So in terms of future research then, there are several recommendations regarding that increased use of a value-centric approach to moral injury in terms of further investigation of the installation and violation of different values, particularly corroboration of my identified value categories, any other different types of values, and which could also potentially inform the creation of a value-centric assessment tool, which moves away from those current assessments based on frequency of exposure or self or other violations, and goes back to the center of what is actually being violated during those specific events, as well as future research to holistically investigate the manifestation and management and intervention for moral injury to acknowledge and address the complexity of what's going on, as well as the potential need to implement and evaluate the practical suggestions that are highlighted for increased moral training and intervention for improved preparedness for encountering and dealing with PMEs. And then also further areas of interest also included potential further investigation of those non-significant veteran group differences that I highlighted. So in a larger population of service police and non-service police veterans, and also equally sized groups, because by the time I got to the survey portion of the phase of the project, there were fewer participants and the sample sizes were slightly unequal, which potentially didn't allow me to identify some significant findings. So maybe exploring those findings a bit more detail in a larger, more equally sized group of service police, non-service police veterans, but also investigating and comparing PME exposure across other potential at-risk cohorts that I identified in the study. And that includes active duty military personnel, civilian police officers, people from other countries, militaries from other countries with potentially unique cultural values, norms, and expectations, as well as across the different service branches, ranks, military roles who might be particularly at risk, including medical personnel, infantry personnel, for example, and also across different demographic groups of military personnel and veterans who are potentially at risk, including sexual gender minorities, ethnic minorities, as well as those from areas of low opportunity education as well. And then the last aspect that could potentially be explored would be more longitudinal studies that investigate the management and manifestation of moral dissonance over time, even potentially from those the military into the civilian context as well. So that's pretty much a whistle-stop tour of my PhD, and hopefully it shows how there can be those specific findings that are applicable to the service police, non-service police population, but also apply more widely in terms of those recommendations and implications to the wider military population as well. Thank you very much.